You're watching CAH-TV, brought to you by the Medicare Rural Hospital Flexibility Program and ICANN. Up next, Rural Healthcare Explained. In 3, 2, 1. There are a lot of differences between a rural community and an urban one, but the need for excellent healthcare, well, that's all the same. This is your community, and this is your hospital. It may be small, yet the services offered are huge because they're essential services like surgeries, an emergency room, and 24-hour healthcare. Without you, people may not get access to these services. This rural hospital, your hospital, is vital to the people who live here. Children, seniors, and everyone in between count on it for their well-being. But more than that, you keep your community healthy in many ways. Maybe it's a rural health clinic or long-term care facility, or services like mental health, retail pharmacy, and EMS, or through community outreach. And you're committed. These aren't just patients. They're your friends, your neighbors, your family. But let's face it, healthcare is challenging, and even today, rural hospitals are still at risk of closure, which means patients suffer. Not only are they losing their local healthcare, but they're forced to travel long distances for medical help with new providers. They might give up on their health altogether. Can you even imagine? On second thought, let's not imagine that. It's too awful. Instead, let's find out what makes your rural hospital so special. But first, a very quick history lesson.
In 1997, Congress established the Critical Access Hospital Program as part of the Balanced Budget Act, which allowed small rural hospitals to become critical access hospitals and offered grants to states to help implement initiatives to strengthen the rural healthcare infrastructure. Being a CAH is a designation given to eligible rural hospitals by the Centers for Medicare and Medicaid Services.
Whew, there's a lot to unpack there. Let's take it slow. What is a critical access hospital, or CAH? A CAH is a hospital in a small rural community that must not close. It's too important, too essential. That's you, your hospital. And you're not alone. There are more than 1,350 critical access hospitals across the United States. That's more than 2/3 of all rural hospitals. The impact they and you have on the people of our nation is immeasurable. So, Uncle Sam is taking steps to help make your hospital as successful as possible. How does a hospital become a CAH in the first place? Well, let's take a look. In order to be designated by CMS, your hospital needs to be 35 miles from any other hospital, and it needs to be 25 beds or less. These beds can be acute care inpatient beds, or they could be for post-acute care, also known as swing beds. Now, don't get the wrong idea. Being a CAH isn't about having less. It's about having exactly what you need to serve your community and the people who count on you. By being a CAH, your hospital receives cost-based reimbursement from Medicare. That's huge. It means getting paid at a rate that covers the cost of the service you're providing. There's also MB-QIP, which is a program that drives quality improvements using patient care metrics and patient engagement scores. By participating in MB-QIP, your hospital is eligible for various rural-based grants. Now, these grants can offer educational resources as well as technical assistance for improving quality, operational performance, and population health. Being a CAH not only keeps your hospital doors open, it ensures that your community has access to acute and outpatient services, primary care for injuries and illnesses, and diagnostic testing. It's all about keeping our friends, our family, and our neighbors healthy. It's about you. It's about us. It's about this critical access hospital. Because rural matters.
It's gonna be alright.